Well, good morning, everybody. Happy Thursday, and thank you so much for coming to our webinar today to continue the conversation from our quarterly meeting last month in September around cannabis use in teens and just some of the concerns and to be able to think through how we as an alliance can do something and what that could look like in this specific area. This topic definitely, I think, got the most feedback and interest from folks that we've had at a from like a quarterly presentation in years. So I'm really glad that you all are able to be here and that we'll be able to record this presentation to continue the conversation and that Lee is here with us again. So again, thank you all so much for being here. And Lee, thank you so much for your time and for just kind of bringing this up and connecting with Jill and then being able to kind of do some work with us to help us kind of group think around what we can do in this area. So I will pass it off to you and we'll go from there. And we will, I think, Lee, when we talked at the beginning, you were saying kind of we'll do questions at the end. So if you all have questions, feel free to put them in the chat and I can track them. And then we'll come to have some time for question and kind of like group think at the end today.
That sounds great. Thank you, Jen. My name is Lee Stewart, and I really appreciate being invited to speak today. This came about because I reached out to the Alliance to see if people who work in suicide prevention are aware of the concerning association that's begun to emerge in research that links cannabis use and suicide, particularly with young youth and young adults. A little bit about me. Sorry, this takes me a minute. I've been working in substance use prevention for about 5 years now, and these are some of the organizations I'm affiliated with and where I've learned some of my knowledge. Particularly the first one, Johnny's Ambassadors. You'll see a lot of my slides are borrowed from them, where I'm a certified trainer and have permission to use some of their slides. And it was started by Laura and John Stack, who lost their son, Johnny, to suicide after he had suffered from cannabis-induced psychosis, which we'll be talking about today. However, the bulk of my knowledge comes from having a son with a cannabis use disorder. And I've seen firsthand the devastating impact that today's high potency cannabis can have on young people and their mental health. I'd like to acknowledge I am not an expert in suicide. That's your realm. But I do know enough to be aware that it is an extremely difficult, complex, multifaceted phenomenon that's likely different for each and every single person who contemplates it. Likewise, no doubt all mind-altering substances can put people at risk. However, I don't believe enough awareness about cannabis as a potential risk factor. People have enough awareness of that, in large part because it's recently been engineered to be a very different substance than the plant we in Oregon legalized in 2014. Since not everybody is familiar with the cannabis landscape today, I'd like to start with a brief overview of what it's become and some of the very serious issues that have risen in the wake of its commercialization. When you think about cannabis, you may think, hey, I smoked when I was a kid. I turned out fine. It's no big deal. However, cannabis has changed a lot in the last 10 years. The greatest marketplace change has been in the strength or potency of cannabis. Previously, THC, which is tetrahydrocannabinol, it's the component in cannabis that makes people high. Previously, it averaged about 4%. Depending on your age, back in the 60s and 70s, it was probably around 2 to 4%. But when we legalized it, it was around 4 to 7%, some inching up. But today, through cultivation techniques and genetic manipulation, the potency of cannabis flower increased to 25 or 35% THC. In fact, stores don't carry low potency buds anymore. Here's another visual demonstration of what that looks like compared to a joint in the 1990s, which was averaged about 50 milligrams THC. Back again in Woodstock days, it was closer to 5 milligrams. But in the 2020, it's gotten up to about 200 milligrams for a single joint. So that's the equivalent of about 4 joints. So you can see it's much, much stronger today. This is a graph from the Drug Enforcement Agency about samples that they seized between these years of 1995 and 2021. And you can see that the red line is the THC, again, the component that makes you high. And the blue line is CBD. Cannabis has over 100 components, which are called cannabinoids. And we really only know much about these two, THC and CBD. And you can see not only is the THC potency increasing, but the CBD potency has stayed the same. And we know that it's actually been bred to be reduced in a lot of the plants. And we know that CBD has the ability to balance out some of the psychoactive effects of THC. So by diminishing its portion, it increases so the psychoactive effect of the THC. But it's also thought that CBD modulates some of the psychiatric harms that occur with it. So it's become, again, even more riskier to use. Again, back in probably the 60s or 70s, the potency was about 2% of both. They were both quite even as they grew naturally in the plant before sort of modern engineering. Another big difference today is that the THC can be extracted from the plant and concentrated to a potency over 90%. This concentrate can be smoked in flavored vapes or dab pens. There's special rigs to smoke them, or else they can be sprinkled inside a joint. Or else in oils. You can see here a vape pen on the right, so that's a concentrate also. And typically they're named after their appearance, such as wax, shatter, butter, oils, etc. You even have crystals, which are almost 100% THC. These are typically called dabs because you just need a little bit, like just a dab. So that's the name you'll often hear. I want to take a moment to look at how these are formed, because once growers reach the maximum potential of THC in a plant, which is around 35, some claim they've gotten it to 40%. But clever chemists had the idea of actually extracting the THC from the plant. And so then you can have a stronger product. So this is a marijuana plant today. And on this picture below, you see these tiny glass-looking sort of crystals. They're what's called trichomes, and that's what contains the THC. The one on the right is magnified about 1,000 times, and you can see that each of these tiny crystal forms almost looks like a golf tee with a golf ball on top. That ball on top is what contains the THC. This is a picture of a cannabis distillation system. So how the THC is extracted is that the cannabis plant is submerged in a solvent, which is typically some sort of alcohol, such as propane or ethanol. And the trichomes containing the THC break off from the plant and they dissolve into the solvent. And the rest of the plant matter is discarded. So you just have the THC in the solvent. Then they run the solvent through a distillation machine, such as this one here. I just pulled off the web. It happens to be a German model, one of the sort of top of the line. And that distillation process isolates or is intended to, the THC from the solvent so that you're getting rid of the ethanol or butane. And what you're left with is the waxy looking substance that we saw in the picture before. That's almost like beeswax or earwax. It's sticky and bronze colored. This can then further be filtered and distilled to make a product even more pure THC. So it's perhaps an understatement to say that what is on the market today is a far cry from the natural plant that we think of as Woodstock weed. It's no longer even just a plant, but it really just is chemicals. So this is the graph to show that the cannabis potency has really skyrocketed once these concentrates have entered the field. You can see visually right around legalization in most of the states, 2015, it really jumped significantly. And unfortunately, according to the National Institute of Drug Abuse in 2021, the adolescent use of high potency cannabis has surged in popularity. We know that among adolescents who use cannabis, concentrates are the most popular form used today, mostly in the form of vaping, because of course they're easy, convenient, they can easily be concealed or discreetly used without people around them being aware. A large study of 8th, 10th, and 12th graders revealed that 72% of kids who used cannabis were using concentrates. And this study also revealed that concentrate users were more likely to go on to use other substances in later years, and that heavy and frequent use is increasing. Again, depending on your age, if you used pot when you were younger, it probably looked something like this joint on the left. But kids today encounter a completely different product landscape and an advertisement when encountering cannabis. There are lots of flavored candy-like treat snacks and treats available. On the right, you can see these are boxes, they're vape cartridges. So in each of those is a single cartridge, which can contain between 1,000 to 2,000 in Oregon milligrams of THC. And they have, enticing names like Watermelon Splash or Orange Dreamsicle. And you can see other products too, the candies and cookies. And here's a vape device. And they also come, with exciting labels and eye-catching images that are attractive to young people. And apparently to adults as well, because a study published last year in 2024 by the National Academies of Science, Engineering, and Medicine, which was based on data from the National Survey on Drug Use and Health, showed that with commercialization, so again, starting roughly 2015, all use is increased in people consuming cannabis. And it's estimated that about 61 million people in the US use cannabis today. And particularly concerning is the number of daily or near daily users that have increased. That's the red line here. And then you can see the amount of use, either people who'd ever used, past month use, a number of days or daily or near daily. Near daily typically means about 5 times a week or 300 times a year. And for the first time ever, daily cannabis use has surpassed that of alcohol, despite the fact that there are 3 times as many people who drink alcohol than use cannabis. So we know that a large number of these users are using quite heavily and perhaps problematically. Here in Oregon, a study commissioned by the OLCC, which is the Oregon Liquor and Cannabis Commission, showed, well, here, let me go back, sorry. showed that just in terms of use, showed that people in Oregon actually consume more cannabis than people in other states. They estimated that 20% of Oregon consumers are daily or near daily users, which is also higher than other states. And daily use is associated with significant mental health and cognitive performance harms. And again, these use at this high is suggestive of problematic use or cannabis use disorder. And it was shown to be highest with among young adults, but also people living below the federal poverty level and those without a college education, which are also the latter two being risk factors for suicide as well. Oh, am I going backwards? Apologize. So no doubt the surge in use is due not only to the new flavored and candy-like products, but also to the rampant marketing and advertising campaigns that have accompanied commercialization. According to a 2023 study commissioned by the OLCC, so that's here in Oregon, people ages 16 to 25 see many more promotional messages for cannabis than health-related ones. And this is promotional, about 73% for this age group, whereas they saw 47 for health related. And I'll point out that actually for adults out of school, that's closer to 30%. So there's even a greater discrepancy in terms of types of messages they're hearing about cannabis. So this might explain why, according to data, again, from the National Survey on Drug Use and Health, Oregon students aged 12 to 17 have the lowest perception of risk from cannabis in the United States, with about 87%, again, this is 12 to 17-year-olds, perceiving no great risk from smoking marijuana at least once a month. And we know that 27% of Portland high school students in 2021 reported current cannabis use. Current research now tells us that storefront availability of cannabis leads to increased risk. There have been multiple studies, but these two are from Oregon. And it found that in towns with cannabis storefronts, adolescents had greater cannabis use, but also cannabis use with alcohol, perceived cannabis availability, lower perceived risk, and perceived parental approval. In addition to the greater availability, it's thought that it's large part and because of all the ads and displays that we see in dispensary windows and outside advertising for them, which all collectively help to normalize use and convey the idea that it's safe. Excuse me 1 second. Did I miss one? Okay. Excuse me. Inversely, here's another study done at Kaiser Permanente in Northern California that looked at over 100,000 kids. And they found that when towns had less retail availability, such as no retail storefronts, there was less adolescent use in those towns. And that the further people had to drive to a cannabis store, the less use was associated with that area. And this correlates with an Oregon study that has shown that a dispensary located within a mile of a school impacts the use rate at that school that's located near it. And a mile, if you know Portland, Oregon, seems like a long way away. So why does this matter? Well, the Kaiser study went even further than the Oregon study and found that the further youth had to drive to find a store, the prevalence of teen psychotic, anxiety, and depressive orders and depressive symptoms also was less in those towns without a retail shops. So let's delve into some of these mental health outcomes a little bit more in depth. So the science is finally catching up with the commercial market. Historically, most research on cannabis has only been done with low potency plants. But there's no more data coming out now that includes high potency products. And scientists are finding that high potency products, which they consider anything over 10%, is associated with a greater risk of anxiety, dependency, suicidal thoughts, and psychotic symptoms. And these issues are especially prevalent in adolescents. So these are four things that I'll discuss a bit more in depth. Excuse me for a sec. This study from Australia showed that marijuana use in adolescents caused anxiety, not helped it, which is often claimed. Like many substances, it may help in the short term, but then leads to greater anxiety. And this study showed that that greater anxiety can increase even in later years after use has ceased. They said daily adolescent cannabis use is associated consistently with anxiety in adolescence and late young adulthood, even among regular users who then cease using the drug. It is possible that early cannabis exposure causes enduring mental health risks in the general cannabis using adolescent population. So let's look at some of the dependency data. Addiction to cannabis, which is a real thing. It's called cannabis use disorder, or CUD, and it has a medical diagnostic code in the DSM-5, which is the Diagnostic Statistical Manual of Mental Disorders. It has the same criteria as other substance use disorders. And I'm sure most of you are familiar with these various criteria and know that in terms of diagnosing a use disorder, if you have 2 to 3 of these symptoms, it's generally considered mild. If you have 4 to 5, it's moderate. And if you have 6 or more, it's considered a severe cannabis use disorder or use disorder, depending what substance you're talking about. So as I said, these are same for all of substance use disorders, so I won't sort of dwell heavily on them, but essentially one of the most important for determining addiction or dependency is an attempt to quit and being unable to, having consistent cravings or being preoccupied with getting cannabis, making it difficult to fulfill responsibilities at work, school, at home, and causing problems in relationships. Also giving up social, occupational, recreational activities because of cannabis use. And using despite ongoing physical or psychological problems that cannabis is likely causing or making worse. Developing tolerance, that's when you need an increased need for more and more cannabis to fulfill or get the same effect. And then experiencing withdrawal symptoms, which are relieved by taking more cannabis. And I'll circle back to withdrawal in particular in a moment, because I think it's particularly important in understanding the link between cannabis use disorder and suicide. Just like in the case with nicotine, in stronger nicotine vapes, with today's cannabis products, the risks of becoming addicted go up too. The young brain is more vulnerable to addiction because it is still developing, and the risk of developing a cannabis addiction increases among youth who are using cannabis at least once a week, with the highest prevalence among daily users. Many adolescents who use cannabis today do so more frequently, and many use daily. This slide is some stats according to the NIDA, the National Institute on Drug Abuse, and I just want to read them because I think they're significant. Their surveys have estimated that 30% of those who use marijuana may have some degree of a marijuana use disorder. That's of all users of all ages. But people who begin using marijuana before the age of 18 are 4 to 7 times more likely to develop a use disorder than adults, again, because young brains are so vulnerable. Cannabis use disorder was higher than alcohol for youth ages 12 to 17, and I've heard it's actually the #1 reason kids are seeking treatment nowadays. And around 19 million individuals 12 and older had a marijuana use disorder in the past year, with 7 million under the age of 25 impacted. For a long time, marijuana was thought to be psychologically addictive, but not physical. But with today's higher potency, it's become physically addictive as well. And when people with heavy use try to stop, they experience withdrawal symptoms. So I'd like to spend a moment looking at what is cannabis withdrawal syndrome. This is a chart from the Cleveland Clinic outlining some of the most common and some of the less common symptoms of marijuana withdrawal. One of the reasons why it's so hard to quit for those who've become dependent on cannabis is that the withdrawal symptoms, not only are they extremely unpleasant, as you can see from this chart below, but they also last longer than a lot of other substances, in part because THC is stored in fat, and it's not water soluble like alcohol, which passes through the body in 24 to 48 hours. Depending on how heavy a user someone has been, the symptoms can be quite enduring. Since some of the milder symptoms like restlessness, agitation, and anxiety can start within just a few hours of having last used, which is why people with vape pens, for instance, having them in their pocket, always accessible, will often feel like they need a hit every few hours if they've become dependent on it. Symptoms of withdrawal typically peak the first week and are sort of most acute for the first 3 weeks. Those will begin to subside. The psychological symptoms, however, can last up to 5 to 6 weeks. So some of these symptoms, just some of you may be familiar, but people get very agitated, sometimes get angry or aggressive. Decrease of appetite is a serious one because the body's become, we all know that smoking weed gives you the munchies, but your body becomes dependent on that to stimulate the sensation of an appetite. Depression, and then insomnia. Insomnia is one of the most troubling symptoms for a lot of people. Not only is it difficult to sleep, but they experience very strange dreams, and these can last up to 5 or 6 weeks. And for heavy users of high potency products, THC can remain in the body for close to 3 months. And while the acute symptoms fade, the impact still lasts. And that's why people who are struggling with a cannabis use disorder, they really do need support, oftentimes medical assistance, because not sleeping for over a month can lead to all sorts of problems as well. It's no doubt everybody here is awake. Again, some of the other milder symptoms: sweating, shakiness, headaches, abdominal pain. Some of you may be familiar with a condition called hyperemesis syndrome that's associated with heavy use of THC and affects people. It's sometimes called cyclic vomiting. It's an inability to stop vomiting. And the only cure is stopping use of cannabis, but that is sometimes hard for people to believe because, for some people, it can relieve a sense of nausea, again, in the short term, but depending again on use, it can become very problematic. Um, Also, as with all addictive substances, I imagine those in early recovery often experience what's called anhedonia or lack of joy. And until the body relearns to make its own neurotransmitters like dopamine, which enables us to feel pleasure and inspires motivation. And so people feel extremely low and often can feel hopeless. And so the risk of relapse is very strong. So again, people really need support and guidance and knowledge in dealing with these symptoms and ways to help people understand. Oftentimes, people think since these withdrawal symptoms will be relieved by taking more cannabis, they believe that it's their medicine that they depend on. And it's hard to understand that you have to experience a long time of discomfort until your body sort of starts kicking in and regulates itself again more normally. And because it's important to understand why these withdrawal symptoms affect so much of the body, it's helpful to understand how it interacts with the body. Much of this knowledge is relatively recent, from the early 1990s, when researchers were trying to figure out what is it about THC that makes people high. And they discovered the receptors that THC binds with. So in so doing, they also found the natural chemical in our brains that THC is mimicking. So this natural chemical in our brain is called anandamide, and it's actually a Sanskrit word for joy or bliss or delight. It's a sort of feel-good chemical in your brain that you maybe associate with a runner's high or feeling of happiness or love. And it binds with receptors throughout our brains and our bodies to regulate lots of functions. So here are pictures of the two molecules. On the left, you have the one that we naturally produce, and it's called anandamide. And over here on the right is a picture of a THC molecule. And you can see that the lower part of these molecules look almost exactly alike. So it's not a perfect match, but the THC binds with the receptors in our bodies. And so the anandamide cannot get there. The THC is actually much more powerful than anandamide. Like any addictive substances, the highest can be much more extreme than you might get from having an enjoyable cup of tea. And it also lasts longer. So it holds on again, it can stay for a couple of weeks. So when the anandamide gets there, there's no place for it to bind. And eventually your body stops making anandamide because you already has something bound there, which seems to be also, regulating those systems. Um, and so, since it prevents our bodies from producing our own natural chemicals. So our bodies produce less of it, and then it means you must use more THC or keep using THC to replace the anandamide that your body is no longer making. So this is what dependency or addiction is. And anandamide regulates what's called the endocannabinoid system. So endo just means within. So it's the cannabinoids or cannabinoid-like substance that we make. That's the anandamide, as opposed to something you're getting exogenously, which is the THC you might smoke from a joint. But you can see endocannabinoid system regulates all sorts of systems in our body. There's two types of receptors. There's the CB1 receptors that are largely located in our brain, but also in other places in our body. And then the CB2 receptors, which are throughout mostly our body and regulate all sorts of functions on the right. So between stress response, inflammation, memory, mood, energy, immune, appetite, it really impacts all of our bodies. Here's a picture of the brain. So all of these little yellow dots are CB1 receptors in our brain. So again, you can see the different areas of our brain, which we now associate with different parts of our body, are impacted. So, coordination, we know it slows reaction time, impairs judgment, distorts depth perception in our vision, slows, distorts perceptions, decreases fine motor skills, but it also inhibits sweating. Remember, one of the withdrawal symptoms is sweating because your body then starts sweating uncontrollably. Ability to balance out our temperatures, etc. And then for those of you more familiar with the specific parts of the brain, I put in this chart, which again, you see the little dots here, pink, are different parts of the brain. So the amygdala, for instance, which is the center part, sort of one of the older parts of our brain, it regulates emotions, such as fear, anxiety, and so it can have the impact of increasing paranoia or panic, for instance. The front of the brain, often associated with motivation and drive, it decreases the desire to do things. And we know, again, that's often a trait, sort of a motivational syndrome of people who are using a lot of cannabis. And we know that a lot of times, young users in particular, but adults as well, they lose interest in what had been passions or interests. They no longer seem as important to them. And so they're not willing to sort of work as hard. And unfortunately, the CDC reports that cannabis use can have permanent effects on the developing brain when use begins in adolescence, especially with regular or heavy use. There's a lot of scientific data now on cannabis increasing the risk of having an acute psychotic break or developing long-term psychosis. An important study published in The Lancet in 2019 analyzed 780 people between the ages of 18 and 65. And they found that occasional use of high potency THC, which they considered anything above 15%, increased the risk of psychosis by 3 times, and that daily use increased it by 5 times. Whereas low potency, below 5%, again, back in sort of Woodstock days, had no association with psychosis. Again, showing the importance of, lower, less strong products. So Denmark has published some very powerful studies. Since they're a very small country with socialized medicine, they can study their entire population of 7 million people and have medical records for their whole population, which is hard for us in the US with HIPAA regulations. In 2021, they published a study saying that before cannabis legalization, schizophrenia rates in Denmark hovered around 2%. But after legalization, it has now gone up to 8%. And in this study, they removed people who had any comorbidities, such as genetic factors for schizophrenia in their family, any existing mental illness, or any depression or things such as that could be risk factors. And they consider the introduction of cannabis into Denmark as a direct cause of going from 2 to 8% of their population with schizophrenia. And they also found that men are at particular risk of a psychotic disorder. After analyzing 6.9 million people ages between 16 and 49 in over 5 decades of data, researchers concluded in 2021 that as many as 30% of cases of schizophrenia among men ages 21 to 30 could have been prevented by averting cannabis use disorder. So, again, problematic use. In other words, if they hadn't used marijuana, they probably wouldn't have become schizophrenic, which is very concerning. This is from Canada, another study. Because other countries do have socialized medicine, they are able to study their population in ways that the US has not been able to date. But we can learn from their data. This is a recent longitudinal study in Canada that studied 11,363 young people, ages 12 to 24. And they concluded that youth between the ages of 12 and 19, so again, teenagers, who use cannabis compared to those who didn't use at all, have an 11 times greater risk of developing a chronic psychotic disorder with today's products. Because of this disturbing data, Canadian authorities updated their cannabis warnings last May. They now have March, excuse me. They now have rotating public health statements on cannabis packaging that state using cannabis before the age of 25 can have several serious consequences, such as affecting brain development and putting the user at risk for severe mental disorders such as psychosis, schizophrenia, extreme paranoia, and addiction. So these are rotating labels, like I know there used to be on tobacco, so each one has a different message so that collectively the message can get out to people using and those around them of the very severe risk for mental disorders of using it. So unfortunately, this has had very serious consequences for young people, especially. According to experts who recently spoke at a session of the American Academy of Child and Adolescent Psychiatry's annual meeting, said that there's mounting evidence that young people's use of cannabis is fueling depression and suicide. And they emphasize that psychiatrists have a role to play in assessing and treating cannabis use and countering the disinformation that is out there. Colorado is ahead of us in gathering information on cannabis use. This shocking data is on teen suicide. And they found that among 15 to 19-year-olds, marijuana is the #1 substance found in toxicology results in suicide deaths. It was present in 43% of these teen suicides, which was almost double the number of teens with alcohol in their blood, which previously had been the leading substance. One explanation I'll add to this is that, again, alcohol goes through the body quite rapidly relative to cannabis. So cannabis does stay in the system a lot longer. So it doesn't necessarily mean that the young person had just used. So it sort of inspired that impulsivity that some people think of. But yet we know, because of the lasting impacts and how long it can stay lodged in the brain, because it is stored in fat, and brains are largely fatty organs, that those negative effects can endure. And so again, probably were a significant cause in their choosing to make this decision. Similarly, in California, San Diego County collects suicide data, and they showed that nearly 50% of all teen suicides included THC. And THC is the #1 drug found in suicide deaths for people under the age of 25. Oregon does not track this number. This study was reported in World Psychiatry in October 2014. So again, this is before legalization, so this is not all new information. And in studying 700 teens between the ages of 12 and 15, marijuana use in those who were not depressed previously increased the risk of a suicide attempt 7.5-fold. This study concluded that any use of cannabis in the early adolescent period is a strong independent predictor of attempted suicide in young adulthood. Similarly, this study conducted at Columbia University found that even occasional use has negative outcomes. They concluded that teens who use cannabis recreationally are 2 to 4 times as likely to develop psychiatric disorders, such as depression and suicidality, than teens who don't use at all. So here is a bar chart of their results. You can see the different colors. So dark is non-use. Sort of in between gray is non-disordered cannabis use, which they also refer to as recreationally. And typically that means maybe once or twice a week on weekends, perhaps. And then the light bar is cannabis use disorder. So those are people with a diagnosis of disordered use. And you can see that really across the board, there is a scale between from non-use, which increases quite significantly, to those with heavy use. And they looked at major depressive episodes, suicide ideation, but they also considered slow thoughts, difficulty concentrating, truancy, low GPA, arrest, fighting, and aggression. So across the board, it looks pretty consistent. And again, a lot of these, it's not news. We know that kids who use typically do more poorly in school. They have trouble with concentrating, with memory, with learning, the cognitive processes that are necessary to learn. And then also even just through aggression, I don't think there is this stereotype that those, stoners are mellow and laid back, but more and more evidence is coming out lately showing a link with aggression. In fact, there have been a number of studies looking at some of the shootings of a lot of young men lately who have been heavy users, which is a very concerning issue that really needs to be paid more attention to sort of figure it out. Cannabis vaping. This study sort of focused on vaping in particular, which we know is the most popular form for young people in consuming cannabis. This study reviewed the charts of 470 adolescents who were aged 11 to 18 who had been admitted to an inpatient psychiatric hospital between the years of 2021 and 23. And they found that not only was vaping the most frequent way of using, but also they said that it might be a unique risk factor for suicide since it was so closely linked to suicidal thoughts and behaviors among youth with acute psychiatric distress. And this study highlighted the imperative that clinicians working with adolescents experiencing mental health concerns, especially those in acute psychiatric distress, assess the cannabis use to be sure that isn't a risk factor that perhaps could be addressed and then relieve some of the distress their young patients were experiencing. In June, this is the last study I'll highlight. I know it can be kind of grim. In June of 2021, NIDA, or the National Institute on Drug Abuse, which is part of the NIH, released the results from a study of 280,000 young adults in the US between the ages of 18 to 35. And they concluded that cannabis use was associated with increased risk of thoughts of suicide, suicide plan, suicide attempt, regardless of whether or not somebody was also experiencing depression. And of course, the greatest risk for the heaviest user, particularly those with cannabis use disorder. This study also found an increased risk of suicide for women who use cannabis. Women also have been found to develop cannabis use disorders more quickly, and that's just something that needs to be explored personally, and I'm not a medical doctor. Since it is stored in fat, I think that perhaps it has something to do with the body content. Not that women are heavier by any means, but we do sort of naturally have fleshier parts in our body. Perhaps that's a reason. And again, this is just my conjecture. But in terms of a lot of these studies, and as you all well know, there's so many confounding factors in for suicide. But a big challenge has been sort of the chicken or the egg in terms of depression. Are people who are depressed turning to cannabis, or is cannabis making people more depressed? So researchers have been trying to sort this out. And increasingly, they're finding significant association between cannabis use and suicide, even after controlling for depression. And there was a recent meta-analysis of over 1,081 articles published last May that concluded that cannabis use should not only be seen as a possible risk factor of mental health disorders, but also as an independent risk factor of suicidal behaviors. For this study here, the NIDA one, I put in a chart. Again, sometimes these charts are hard to read. I know the type is very small, but again, what I like about them is the visual makes it easy to sort of comprehend. So the different colors in this case are women and men. And again, you can see a lot of times the women have sort of a higher risk in terms of the various categories of suicide ideation, suicide plan, and suicide attempt. And this is a study that I just mentioned that's trying to weed out the influence of depression. So MDE is a major depressive episode as opposed to no depression. And the different variants, so CUD is a cannabis use disorder, so we know severe cannabis use as opposed to none. But then it also measures just cannabis use, which is not daily, so daily, not daily, or none at all. But across the board, again, like the other Columbia study, you can see that the risk is higher for those who are using cannabis, and especially those who have disordered use of cannabis. Sorry. And the lead author from NIDA of this study concluded suicide is a leading cause of death among young adults in the United States. And the findings of this study offer important information that may help us reduce this risk. Depression and cannabis use disorder are treatable conditions, and cannabis use can be modified. Through better understanding the associations of different risk factors for suicidality, we hope to offer new targets for prevention and intervention in individuals that we know may be at high risk. So I want to end on this sort of relative note of optimism, that we do know that both depression and cannabis use disorder are treatable conditions if people are aware of the risks. So going forward, we need to educate parents and teachers, but especially those working with kids at risk, such as clinicians and therapists, psychiatrists, and also consumers. They have a right to know the risks of the products that they are using. And I don't think this is a message that is heard enough. We saw that Canada has instituted very severe warnings, and Colorado and California now also have very clear warnings about the risk to those under 25 of using high potency products. OHA and the Oregon Medical Marijuana Program have been reviewing the health statements with cannabis, and those new statements are due to come out very shortly. I heard they were due at the end of September, but I haven't seen any mention of them, but maybe some of you have who are affiliated with the OHA. I know from my personal experience with my son that all the experts we turned to, the pediatrician, his coach, his therapist, he even had 3 ER visits, all just said, it's just weed. All kids experiment, he'll outgrow it. But 5 years later, he's now 21, he's still struggling with it. And quite frankly, we do worry about him. So we need to change the narrative that it's not just weed, and really push back at the industry that, quite frankly, is marketing to our kids. It's an addiction for profit industry, just like nicotine and alcohol. They know if they get kids early, they'll likely have lifelong users. And addiction is a preventable disease. We know the most protective risk factor is delay of onset of use until their brains have developed. Prevention is the cure. If we can reduce adolescent use, we'll significantly eliminate a significant risk factor for suicide. So thank you for your time and attention, and I'm happy to answer any questions.
Thank you so much, Lee. That was an amazing presentation. I really appreciate your time and all of the work that you put into that. This is going to be just really helpful and just, again, is like a really amazing presentation to talk through things. Do folks have questions or comments that you'd like to kind of bring up in the space or to talk with Lee more about? We definitely have time for questions or conversation. Erin?
Yeah, I did have a question. I was able to attend kind of your short
Mhm.
lecture, and you had talked about the effect of cannabis use on the efficacy of antidepressants, specifically SSRIs. And I didn't see that in this presentation, but I'm wondering if you might be able to share some of that information as well, even
Sure.
if you share it out.
Yeah, no, absolutely. Um, it's true. It interferes with hundreds of medications. And actually, there's a website, I believe it's just a US site that you can check with any substance that whether or not, I'm hearing an echo now. I don't know if anybody else is. But if it interferes, and we know that cannabis does interfere with the most popular SSRIs like Prozac, Lexapro, et cetera, and it increases their efficacy. So that's another thing that people should know while they're taking it, but also that doctors should know.
Would you, would you be able to share that website
Yeah,
with us?
I will. I don't know if I can find it right this minute, but I definitely will.
I can make
Awesome.
sure
Thank
it
you
goes
so much.
out. I can make sure it goes out with the recording link to the
Sure.
listserv when I send that out, Erin, so I can get that from Lee and include it with everything.
Yeah, it also interferes with heart medicine. That's been a bit significant for elderly people, particularly who have arrived in the ER because their arrhythmia has acted up. And so there are a lot of health reasons. There was a Dr. Ronit Lev, some of you may be familiar with, in San Diego, who tried to pass a bill that pharmacies had to give out information about drug interactions with cannabis. They talk to you about other interactions if you shouldn't drink, but it didn't pass in California. But I think too that should be something that people are more aware of.
Jill?
Thank you so much. Wow, this was amazingly. I'm so thrilled I got to jump on and hear this talk. This was just so perfect timing, and really I'm so glad that you're sharing your voice and making sharing awareness about this issue. I just had one question. You had mentioned about OHA working on some statements to be posting. Is that going to be like required for stores to post on packaging or in the stores, or How is that going to be rolled out? Do you know?
I do not. I listened in to a couple of the Cannabis Commission meetings, and they were still ironing out the statements, but I do not know how they will be distributed. I assume they'll be on their website, but I'm hoping that they will also be shared more broadly. I'd love to see a public health campaign here in Oregon. Um, because I do think that information needs to get out, but there are conflicting interests on that matter. So I'll say it in a diplomatically way as possible. But yes, it is something I think needs to be shared widely.
I agree. And same with like the use in pregnancy and breastfeeding. I know that there was
Absolutely.
some requirements to be posted, and I don't
Mhm.
know how aggressively they're enforcing that. But yes, I'd love to be part of any campaign to get the word out. So let me know how I can help.
I'd love to. Thank you, Jill.
Any other questions or comments that folks have for Lee or for the group as a whole? There is,
I have a question.
yeah.
First, Lee, that was a fantastic presentation. The Mental Health America just sent out their 2025 report of mental health in America. And Oregon was number 51 of the states in terms of prevalence of mental illness in youth and adults. And do you have any thoughts about cannabis use potentially as being related to that?
Well, first of all, it's a heartbreaking statistic. I'm sorry to say that's one of the things that Oregon has become sort of leading the stats in. And it may have also mentioned that we have some of the least amount of treatment for our young adults. At one point, I know we were listed 50th for that. I can't help but thinking that it is a factor. Obviously, there's so many factors in mental health issues today for young people. Um, but given that we know for Oregon youth, our use is up amongst the highest across the country. We had the number one least perception of risk in using, which we know that is a heavy risk factor for people turning to substances if they don't feel like there's any risk involved. Um, so I think it's something that needs to be addressed. We need to have better education in our schools, better messaging. I know all three of my children were taught that it was not addictive, it's not as bad as alcohol. They all, young people seem to think it's fine to drive. That's also another issue we need to deal with. But again, I think the more people we can educate on this issue, the better we'll be, which is why I originally reached out to the Alliance because you guys, are very sort of key players in this realm and can help spread the word and educate and make sure that people who are working with students, I know so many parents whose therapists told them, oh, don't worry about the weed's fine. And oftentimes they're diagnosed with other ailments, some very serious, like bipolar or schizophrenia, and it's actually cannabis-induced psychosis that fortunately, typically the first time somebody contracts it, it can last anywhere, up to a couple of months. But if they return to use each time, the risk of, chance of recovery becomes less and less. And sadly, it's really leading to an epidemic of particularly young men with schizophrenia diagnoses. And
Thank you, Lee.
cannabis-induced psychosis isn't treated the same way as schizophrenia. So that's another problem is we still need to find out medications that can help.
Thank you.
Mhm.
What other questions or thoughts do folks have today? Oh, and Pam put in the chat the site that Lee mentioned where you can find medication interactions. Thank you, Pam.
Oh, thank you, Pam.
So I know our lethal means safety subcommittee has talked through wanting to find out ways to kind of share this information. I guess as Lee shared multiple times, kind of like in the presentation today, is that just that awareness and being able to have conversations and talk about it is an extremely important next step just to kind of just to help. And so Lethal Means was wanting to think through how to share information in a way that like young adults and like youth can hear the information and have a conversation about it. As was also shared, I know like with me when I work with clients, whenever weed is brought up, and I started talking about like some of the concerns around it, immediately they're just like, oh, like you don't want me to have fun, like you're stupid, all those, and just kind of like really shutting that down and not wanting to talk through it. And so it's made me kind of learn different ways to address it. And that's something that we're wanting to give providers information about, is how to talk about it with youth, how to bring up the conversation so that way you can get to some of those concerns without their ears just completely shutting down, and for them to be able to kind of hear
Yeah.
things. And I know some of our subcommittees are wanting to like join that. It'll live with Lethal Means, but some of our other subcommittees like schools and transitions of care are wanting to also help kind of think through like information and questions and different things that they want to talk through so we can give those recommendations to OHA and other organizations around stuff that
That'd
can
be great. And there is a good, it's called Let's Talk Cannabis that Clackamas County, they hired this excellent organization in California. I'm blanking on the name, but they helped us prepare. It's a good way for parents in particular, but people to speak. Cannabis in particular, it's a really hard topic if somebody is using and really likes it. And there's enough public sort of normalization of its use to make you sound like rah, 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 and the sort of back and that your sort of scare tactics and whatnot. So it's true. You have to delicately tiptoe around. I've heard that motivational interviewing is a good way to sort of open-ended questions to get people who are using to think about their use, maybe in a more critical way. I know that's a tactic that's taken with people in treatment. But the normalization, the widespread sort of its sort of coolness, the adolescent humor that comes with a lot of the names we see on dispensaries and the promotional ads. It's all kind of a big joke. And then we have all the product, like the t-shirts, the hoodies, Crocs even have marijuana leaves on them. It's so widespread. There's a man named Ben Court who runs a treatment facility in Colorado who speaks very movingly about culturally how it's so hard for these young people who are in treatment, one, to accept that it is an addiction. First of all, they're kind of bullied by the kids who are addicted to stronger substances. But also, when they go back from treatment, they're surrounded in a world with sort of messaging and sort of positive images. And, he was talking about his own experience when he was getting off of heroin. It's not like people had tattoos of heroin needles or wearing t-shirts. So really, for these young kids is very, very hard because our culture, certainly not here in Oregon, and I can only speak for Portland, Oregon, but there really is this attitude that, yeah, it's fine, it's natural, it's a plant, which is why I went through sort of showing you the machine and the process. This is no longer a plant that these kids are using. It's chemicals. Just like any other drug, where, it's almost like cocaine to a poppy. The THC has been extracted, the plant is thrown away. And, it's a drug, but it's not thought of that in the general public, which makes it hard.
Yeah, I agree. Anything else that folks would like to talk through or talk about or bring up today? And if anybody has any questions afterwards that come up for you, feel free to send them to me and I can send them to Lee so that way we can just get those out there. And then if folks are interested in wanting to continue this conversation or have any ideas for like next steps for the Alliance or things that we could do, let me know and we can see how we can add that into the Alliance's work. Awesome.
Yeah, and if anyone wants to reach out to me as well. And on the side note, some of the people I know on here know that I've been advocating for safer cannabis policy and trying to get our legislature to consider having stronger warning labels or capping the potency on products, limiting the amount of candy-like products that we have available, or else the advertising. In Oregon, we're very limited by limits to advertising and packaging because it's considered free speech, but there are other things we can do. And certainly a public health campaign would be a good way to start. The Rethink the Drink campaign, I think, has been excellent in sort of raising awareness of some of the harms of alcohol. And it would be nice to also have something equivalent of that for alcohol. So if anybody is interested in those kind of efforts, please contact me also.
Awesome. Thank you all so much for your time. And this recording will be on our YouTube channel by tomorrow at the latest. And so feel free to share it out. And yeah, thank you all so much for your time. And I hope you have a great rest of your day.
Thank you. Thank you, Jen.
Yeah, thank you.